if you look at the functional outcomes and see, is there a difference? Well, actually, there isn't. So this article went through a whole meta-analysis. And this is a stratification. So it was a fairly good meta-analysis. And then it shows that really there is no difference in the outcome except for the reoperation rate. So if you have it open, you have a higher risk, 2 times more risk of subsequent surgery, and implant removal is 8 times more risk after screw fixation. So the outcome is the same in both ways. So it comes down to experience and economics and whether you could justify a big wound, and that's different areas. So I have nothing against doing what is best for the patient in the hands of that surgeon in the environment that they're in. So this is actually one of my operation notes. So you could say they're not easy surgeries. So this has taken me an hour and 15 minutes. And a couple of arthroscopy portals, nothing too much in terms of incision. Fixed the spine, fixed it with a standard technique. So I thought I'd show my op note to say it is something that I do relatively regularly, and it gets easier as you go along. But a couple of points. Early rehab, so you can see down there it says home today. Full weight bearing, and I'll give them 20,000 units of vitamin D 3 times a week. I think I've got the wrong pointer again. So I think that's the other thing about arthroscopic is they're home the same day. They're having their dinner, they're sleeping in their own bed with mum and dad that day. Rehab, you touched upon it already. I go a bit slower, but then you've got to really pick where your physio is and who they're going to see. And rather than go through all the videos of the techniques, there's one paper using no implant, so just the sutures, and the other one using the same technique or similar technique, and they're freely available videos if you want to see, and these are the type of pictures you get from their videos. The other thing is where the arrow is in D, the lateral meniscus can get trapped. So if you are doing it arthroscopically, one of the reasons why I've seen people fail is not recognizing that the lateral meniscus is trapped. So you've got to release that and go underneath and clear the bed. But those videos tell you everything that I would want to tell, and you could do it at your own place. So in summary, you could do whatever you want, but be prepared for a higher revision risk. And my way, little Johnny or whoever it is back with their parents that night. Thank you.